Okay, so this is communication and athlete education skills for the athletic trainer. So developing a holistically trained athletic trainer, ATs must be able to communicate and educate patients to be able to put the patients at ease when telling them about their injury they have, and they must be able to identify the symptoms that the patients are having, and they must be able to translate complex medical information into terms that various types of patients can understand. So we need to make sure that we're able to say things in different ways so that different athletes can understand what's going on with them. And a holistically trained athletic trainer takes the complete athlete into consideration from a biosocial perspective. So the basics of communication, you have verbal communication, which involves the use of written or spoken messages. So just us talking to the athlete. And we also have nonverbal communication, which involves the expression of ideas and thoughts or feelings without the use of words. So like our body language when they come into the athletic training room, or when they talk to us at practice about their injury. And this is the communication process. So there's a sender who sends a message, and they encode it, sending it to the receiver, and the receiver has to decode the message and then send feedback back to the sender. Um, and nonverbal communication, it's important to be aware of these things when we're talking to our athletes. So touch, gestures, facial expressions, body language. Um, And can you think of examples of each, as well as examples of how they can be misconstrued? And so, say, like, been a busy, hectic day in the athletic training room, and another athlete walks in and says something else is going on, and we kind of just take a step back, and like we become frustrated, and they can see it on our face. And that right there that's nonverbal communication that can show the athlete, like, oh, we really don't want them there, or we're tired of people coming in, but really it's something else going on with our day that is not having to do with the athlete. So we need to be careful about how, like, especially our facial expressions and body language can affect the athlete. One-way communication is where information flows only in one direction. So the sender sending messages to the receiver, but they're not able to give any feedback or ask any questions. And in two-way communication, one person sends a message and the other engages in listening and attending skills. So the person is sending a message to the receiver, and the receiver is able to decode that message and give feedback. So ask questions, what's going on. And we did this with the activity the other day. And it's really interesting to see how a lot of us thought we were communicating really well, but when we turned around to look at the pictures, they were something completely different. So I think it's important that we realize how other people take in, like, what we're saying. Building rapport with our athletes. When an injury occurs, a relationship with the athletic trainer, because one of the athletes with most connections. So they're more likely to listen and adhere to what they suggest. If we do have a good relationship with that patient, because if you then has no idea what's going on, they're going to be really skeptical of what he says, and they're not really going to have any trust in anyone. So it's really important that the athlete kind of knows who we are, and like we know what we're doing, so they don't think that we're just doing random things for them. And it's really important to ensure optimal physical and psychosocial recovery for the athlete. So establishing a rapport before the injury is also really important. So we're able to know how the athlete is normally, and then building a rapport after the injury also, we're able to support the athlete and effectively communicate our strategies that we have for them. And also we build confidence and trust with them, so they know that we are confident in what we're doing, so they can trust us that we're going to get them back to play to their sport. importance of injury education, facilitating an accurate understanding of the injury and its associated consequences has a direct effect on the athlete's cognitive appraisal and consequently their emotional and behavior reactions following the injury. So athletes who are uncertain or lack an understanding of their injury will often make inaccurate appraisals of both the demands and the injury situation and their available resources. So just to give an example, when I was working with men's soccer, we had 2 athletes that had 2 different injuries, but the rehab was kind of the same. And one of the athletes thought that we didn't know what we were doing because the guy that he was doing rehab with usually every day was doing the same thing, and he thought that he had a completely different injury than what we told him because he was doing rehab the same as another guy with a different injury. So it's important that they understand they both have different injuries, but also some of the rehab is the same on what they're doing. So they don't think that we're just kind of like, oh, well, here you go do this. Quality education of injured athletes is also important because of its relationships to motivation. So the more that the athletes know, the more they're gonna want to move on and they're gonna understand why they're doing things. And people have a difficult time giving optimal effort to something that they don't understand. So like I said, when you have an athlete that doesn't know who you are, doesn't have a relationship with you whatsoever, they don't understand what's going on, and they're probably not going to do everything 110% because they're like, well, I don't know why I'm doing this. I don't know what it's going to do. But if an athlete is able to understand why behind the rehabilitation activities, they're going to be more motivated to adhere to the rehab program and what we want from them. And how we should deliver educational information. We should be able to break down the information into manageable doses. So we shouldn't be throwing everything that's happened to them and what we expect them to feel like maybe the next couple of days and what we expect them to do in the next week or two. We shouldn't do that all at once. We should be able to focus on you got hurt, this is what we want you to do the next 2 days, and then the next 2 days when they come back in, explain what we're going to do the next time. We shouldn't throw all that at them at once. And we should use language that the athletes can understand. So again, making sure that we're able to explain things in different ways, not talking in full-on medical talk. We're able to make sure that the athlete understands what's going on. And we can also use written material to complement verbal communication. So we can also write down what's going on with them to give them to be like, if you have any questions, like here's some things on paper so you can look over it to help you. And we should also maintain two-way communication in the educational process. So make sure that they understand what we're saying and they can ask questions if they have any or any concerns back and forth between us throughout the entire process. Facilitating a positive coping response. When delivering injury information, it is important to send informative messages regarding diagnosis, prognosis, and treatment options. And we should help the athlete accept his or her injury at first because the quicker they accept their injury, the quicker they can start their rehab process and understand how the rehab is going to help them and not be focused on why I'm hurt or why did it happen to them. And we should use understandable language so they understand what's going on with them. And we should focus on delivering information in a clear and concise manner. So we shouldn't be jumping all over the place. Well, this is this and this is this, but you have this. You should be able to put the information in order to where the athlete understands, like the anatomy. Like this is what it's like the ACL. This is what the ACL does, and this is what your leg did. So maybe just saying that in a different way makes them understand better. And we should only give athletes the relative information. So like if we say they have a torn ACL, we shouldn't tell them that we tested for their MCL and LCL and those tests were negative. And we also tested for meniscus things and they were negative. We should just tell them that we think they have an ACL injury at this point. And we should also educate athletes about their pain expectations. Injured athletes need to be realistic about the likelihood of pain during both the injury phase and the recovery phase. And proper communication can assist in shaping the athlete's perception of pain and the meaning of pain. So we should say, like, again, a torn ACL, we should expect them to be in some pain and discomfort, just so they know. They don't call us, well, my leg's a balloon and my knee hurts, I can't move it. We should tell them before they leave, like, hey, like, tonight you're probably going to be really stiff, not going to want to move your leg, and tomorrow morning, it's probably going to be a little worse, just so they know those things, so they're not like, oh, they didn't tell me this, like, that something's wrong, like, I need to, go to the emergency room, things like that. They should understand that during when the injury happens and during the rehab phase. Sometimes athletes don't understand how hard the rehab phase can be sometimes. So they should understand that there's going to be times where they have to push through the pain with rehab and they're going to be sore. They should know the difference between being sore after some exercise and knowing when to step up and say, like, this is really hurt, like, I need, like, something else for this. Communicating rehabilitation expectations and effort required. Providing information about what should be expected serves to decrease athlete anxiety and answer unasked questions. So providing a clear explanation of the rehab regimen that they're going to be going through, so they understand kind of what it's going to be like getting back to return to play. And involving the athlete in the goal setting can also be really beneficial. So rather than us just telling them, hey, in 2 weeks I want you to be here, we should sit down and just have little goals for them to go along, so then they also can get excited about when they're meeting their goals or when they're falling behind a little bit, and giving them that extra push sometimes to kind of help them move along where they need to be in the rehab process. And communicate the expectation that athletes are responsible for their own treatment and recovery, that they should understand that we can't do it for them, that we can tell them what to do and what's going to make them better, but they have to put in their time and their effort to get better in the end from their injury. Communication during the return to play or the return to activity process. As injured athletes prepare to return to sport, they may fear re-injury or worry about not regaining their pre-injury skill level. So we should communicate with the athletes about any physical or psychological recovery concerns. So say, like, before an athlete goes back to play, we can ask them what they're worried about. Say they're worried about this one certain move, like when they're running, if they have to cut, we can show them what they've been doing in rehab that's prepared them for this, and that they can do it in the rehab setting, that they're going to be able to do it when they return to play. And the decision to conclude rehabilitation and return to sport should not be underestimated. So communicating with the athlete about their feelings regarding return to play is also really important. Communication and education of other involved parties. So keeping the physicians involved, first when there's been an injury to an athlete, and also we have to keep them in the loop when we're trying to get, like, the x-rays and MRIs and the surgery schedules. It's really important you have to have a physician there to do those things. And parents and family members, like in the high school setting, it's really important to keep the parents involved, so their kid just doesn't come home and tell them, like, hey, they told me I tore my ACL today, like, this is what we need to do, and the parents freaking out about what's going on. Like, the parents need to be informed. Sometimes, a lot of times when we tell an athlete something, it gets turned around, especially if they don't understand, and they try to explain to their parents and they end up telling them something completely different than what's actually going on. And the other thing that's really important, or other people that are important to keep in the loop, is your coaching staff, because it's important that they know what you're doing and why you're doing it with certain athletes. So you're holding this person out from full participation today because of this, and this person is non-contact today, like, say, in the football scenario for this, and it's just important to keep everybody in the loop so they can continue to trust you and they think you're doing good with what you are doing.